Good morning. I think this is a introductory class for MBBS third. Start with the pharmacology in general and what are the different drug sources and in which the dosage forms it is available for clinical use. If I describe pharmacology, it is a pharmacon, that is drug, and logos or discoursing, and which consists of detailed study of drug, that means its source, physical chemical properties, biochemical physiological effect, pharmacodynamic, pharmacokinetics, therapeutic and clinical use, and its toxic effect, that is toxicity. Broadly, pharmacodynamics is a study of biochemical and physiological effect of a particular drug and how it acts, means mechanism of action. And pharmacotherapeutics deals with the uses of drugs in the prevention as well as treatment of disease based on pharmacological study. It includes all the drugs used for diagnosis and prevention also, like vaccines and all that. Pharmacokinetics deals with a fine alteration of the drug by the body, which include absorption, distribution, binding, biotransformation and excretion of drugs. So broadly, pharmacodynamics is what the drug do with the body, and pharmacokinetics is what the body do with the drugs, means how it is absorbed, whether it is absorbed in stomach, intestine or where it is distributed, means binding with the plasma protein or elsewhere, and biotransformation, that is a metabolism, both anabolism and catabolism, and how it is excreted out, mainly in a urine form or fecal material or breast milk or sweat, how it is excreted out. Toxicology deals with the side effect, adverse effect and toxicity. Side and adverse effect which are produced within the therapeutic dose range of a particular drug, and toxicity occurs when the dose is increased or which is in a toxicity. And chemotherapy deals with the effect of drugs upon microorganisms and parasites without destroying the host cells. This is the official definition of drug, which is given in a pharmacopoeia, which is an official compendium of any country, generally released by the Ministry of Health of a particular country. The drug is any substance or product that is used or intended to be used to modify, here means for clinical purposes and all that, to modify or explore a physiological system or pathological state for the benefit of the recipient. Recipient may be a patient, recipients may be a volunteer for new drug. I told you about pharmacopoeia. It is an official reference containing a selected drug, medicinal preparation with their description, tests for their identity, purity and potency with the average doses. This is just look of the different pharmacopoeia, like Indian pharmacopoeia, British pharmacopoeia, United States pharmacopoeia, British Pharmaceutical Codex, National Formulary, BNF, or National Formulary of India, NFI actually, and Materia Medica, which deals with the source, description and preparation of drugs. The others are the Ayurvedic Pharmacopoeia of India, Unani Pharmacopoeia, as well as they have homeopathic pharmacopoeia also, Merck Index, Japan Pharmacopoeia and other countries' pharmacopoeias. What are the sources of drug? Actually, these are all the drugs are mainly obtained from plants, animal, microbes, mineral sources, but a majority of them are from synthetic or semi-synthetic sources. The plant origin, broadly they are alkaloids. If you Just see the phytochemical structure of that. Alkaloids, glycosides, oils may be a fixed or volatile, resins, gums, and tannins. The few example of alkaloid, like basic substance containing a cyclic nitrogen, the chemistry point of view. The important one is morphine type of drugs obtained from opium papour somniferum. Quinine, there's an anti-malarial compound, and further the drug used in a myocardial infarction, quinidine, obtained from cinchona, that is dalchini. Atropine type of drugs, homatropine and all that. This is for the diagnosis of all ophthalmological disease, obtained from belladonna. Pilocarpine, again used in Pilocarpus species. Vincristine, vinblastine, potent anti-cancer agent, obtained from the Vinca rosea plant. Reserpine, antihypertensive drug, obtained from the Rolfia serpentina. And cocaine, the CNS stimulant, obtained from the coca leaves, the erythrogylline coca. Glycoside, it is a ether-like organic structure combined with a sugar and non-sugar component called aglycone or genin. The drugs obtained are digoxin, used as a cardiac glycoside, obtained from digitalis, strophanthin, and cyanosides, used in a laxative property in a GIT, obtained from strophanthus and a senna leaves, Cassia acutifolia. Oils, they are the glyceride of oleic, palmitic, and stearic acid, mostly edible, and some are used as drugs. Which are used as a drug is a castor oil for laxative property, obtained from the castor seeds. Olive oil from olive seeds. Theobroma oil, which is useful for the preparation of skin cream and suppository, obtained from the cocoa butter. And cod liver and shark liver oil, obtained from the animal sources, fish, and they are the rich sources of vitamin A and D. Volatile oil, they contain the hydrocarbon terpene. The important one is a turpentine oil, used as counter-irritant, obtained from the mentha, lemon oil, frabling agent in all type of syrups and external preparation. Peppermint and cardamom oil for carminative and flavoring agents. And oil of clove, which containing mainly azeusinol, used in a toothache. And all these compounds are pharmaceutical excipients which are used as flavoring agent in the preparation of different oral as well as external preparations. Resins, these are obtained from the plant sources, basically oxidation and polymerization of volatile. They contain mainly oleoresin, gum resin, balsam, and tolu. Mainly used as a local stimulant and in preparation of expectorants used in a cough, wet cough. Gums, these are the secretive product of plant, pharmacologically inert, but used as a suspending or emulsifying agents like gum, acacia, and tragacan. Whenever there is a need to mix two oil and water to make it a emulsion, we use gum. Tannin, they are the non-nitrogenous constituent of plants, phenolic derivative, and used for their astringent property like black catechu and ashoka bark. Mucilase, these are used in a emollient cream for their anti-aging and antioxidant property, and the example is aloe vera. And the only component used obtained from the mineral sources is liquid paraffin, used as a purgative in a constipating patients. These are few drugs which are previously obtained from animal sources, but now they have shifted to recombinant biotechnology, like pancreas of beef, useful for the insulin. Thyroxine was obtained from thyroid gland. Vitamin A, shark liver, and liver of Gadus fish is vitamin A and D. Horse blood was used for staying antiserum, still used. Hyaluronidase, the anti-inflammatory component, was originally from the bull testis. Pepsin from the stomach of beef and pig, and surgical ligature and suture from the intestinal tissues and tendons of animals. From human beings, the immunoglobulin from blood, placental extract from the placenta, chorionic gonadotrophin from the urine of pregnant women, and growth hormone from the pituitary gland. But everything is now shifted from to recombinant DNA technology. From microorganism, there are many components which are used initially from the microorganism, and still the base component is from the microorganisms also, like penicillin from the Penicillium chrysogenum and Penicillium notatum, streptomycin from Streptomyces griseus, erythromycin, Streptomyces erythrans, chloramphenicol, Streptomyces venezuela, tetracycline, Streptomyces orphans. These are all antibiotic, broad spectrum and narrow spectrum. Polymyxin B is an antifungal antibiotic from Bacillus polymera, bacitracin Bacillus subtilis, nystatin antifungal, Streptomyces noraci, grisofulvin, again an antifungal component, Penicillium grisophilium, streptokinase, the enzymatic preparation, Streptomyces pyrrazine, and vitamin B12, the cyanocobalamin from the Streptomyces griseus. The genetically engineering drugs, like I told you, recombinant DNA technology, like human insulin, hepatitis B vaccine, and other vaccines also, interferon alpha 2A, and oral polio vaccines. Now, if you just see, obtaining a drug is a different issue, but to administer it into a patient, it should be in a particular dosage form, means a palatable one which containing an accurate amount of active constituent. It can be solid dosage form, it can be inhalation form by given inhalation, and it can be a semi-solid liquid dosage form. So solid means a tablet or capsule type, semi-solid or liquid. Semi-solid means it can be a cream or ointment, or liquid, it can be a syrup and all that, and inhalation, it is a inhalation form to be given by inhalation route. Solid dosage form can be of internal also and external. Internal means to be taken by mouth within the body system, GIT, and external outside GIT. It can be capsule, granules, effervescent granules, powder, tablet, and external can be dusting powder like a talcum powder, insufflation, suppositories, pessaries, bogies, and plasters. I'll come to detail individually. Semi-solid or liquid dosage form, internally it can be aqua, elixir. Aqua is a simple medicated water, elixir is a syrup, emulsion is a oil in water or water in oil, gel like Dizine gel, linctus like cough linctus, mixture, solution, parenteral solution which can be given by intramuscular or intravenous, syrups, cup syrup and all that, tinctures, a concentrated one. External can be application, can be a cream, can be a ear, nose or eye drop, enemas to be given in a constipating patient, gargles, irrigation solution, liniment, lotion, mouthwashes, ointment, paints and paste. Inhalation can be aerosol, it can be sprays, or it can be a vitriolet. Semi-solid, solid for internal uses, it can be capsule. There are two type of capsule. This is call it as a hard capsule. Have you seen this blue and red and yellow and this one, in which the powder can be filled. The example is a capsule ampicillin, tetracycline or theophylline. It's mainly useful for the powder drug. Soft capsule like this, it is for the encapsulation for oils or solution like capsule vitamin A, vitamin D and vitamin E, garlic peels you must have seen, 7Cs, and eye applicators for external application, in which the chloramphenicol is filled. Granules, it is a mixture of active medicaments, sugar with some flavoring agents like para-amino salicylic granules, PAS. This is the important drugs used in the treatment of tuberculosis. Effervescent granules, which is a mixture of citric and tartric acid with sodium bicarbonate and sweetening agent, which on mixing with water give effervescents like Eno powder. Medicament in the powder and dry form. It can be a simple or compound powder like aspirin powder, powder enclosed in a capsule or sachets like ampicillin or ORS powder, and powder for external use like dusting powder. It can be for both internal and external, like ORS for internal and dusting for the external use. Tablet, it can be of many types. It is a compressed granulated powder drug. Simple tablet like aspirin disintegrate very easily. Soluble tablet like disprin dissolve in a water to form solution very easily for faster action. Scored tablet which can be divided easily in case the half is needed like this. It can be a lozenges which contain mainly sugar and gum for slow release of medicament like Stapsil, Vocacil and Vicks for the local action, and Pasil softer than the lozenges one. It can be a chewable tablet, chew in the mouth for systemic action like Diazine, Suxi and Mabax. Mabax is a drug for elephantiasis containing a mebendazole. Buccal or sublingual tablet, it is to be placed under the tongue like nitroglycerin. Implant used for sustained systemic action for months together like Asmapex depot and certain hormonal preparation for contraception. Entry-coated tablet, it is to be coated with a keratin, cellulose acetate like ethylene, just to avoid dissolution of that particular tablet in a acidic pH. So it is called it as a entry-coated tablet. Solid dosage form, external use, it can be antibacterial powder, it can be a talcum powder. And insufflation, it is used by insufflator in a various body cavity where the powder is difficult to apply directly, like it can be an ear or nose, etc. Suppositories, it is a conical, I told you the main source of cocoa butter oil or theobroma oil. It is a conical solid preparation made of theobroma oil or glycerin gelatin jelly, which can be melted at body temperature and release drugs. It can be for both local and systemic action like Dulcolax and glycerin suppositories for the hemorrhoid. It is to be administered in a the final junction of a GIT, that is in a colon area where it can be release the drugs at a body temperature. This type can also be useful for the vaginal introduction, both molded and compressed one, for contraception or for antibacterial, antifungal action like betadine, passeries. So for anal route, it is called it as suppositories. For vaginal route, it is called it as passeries. For nasal and urethral administration, it is called it as a bogies, and for application in the ear, it is called it as ear cone. So there are basically 4 type of suppository. It can be used in an anal one, the urethral nasal one, vagina one, and a ear cone. Plaster, they are the solid adhesive material. On one side there is a adhesive material which is generally a black in color, and another side there is a cloth to lessen pain on the boils like this one. Aqua, the semi-solid or liquid dosage form, internal one. This is the aqueous solution of volatile substance like peppermint water, mainly useful as a excipient for making a pharmaceutical preparation. Elixir, this is the liquid oral preparation, pleasantly flavored and colored, the like bronchodil elixir. Emulsion is a suspension of fat or oil and water using as emulsifying agent like castor oil emulsion, useful in a for producing a laxative action in a constipating patient. Gels, it is a aqueous colloidal suspension of insoluble medicament. Whenever there is a more insoluble medicament there, so it make a gel type of structure which is to be taken after shaking. The example is Diazine gel and Mucin gel. Linctus is a viscous liquid oral preparation containing high proportion of sugar and glycerin for viscosity for demulcent action on throat. like for dry cough, cough linters. It remain for longer period of time in a buccal cavity so as to produce a demulsion action on the throat. Mixture, this is a liquid oral preparation. These are cough mixture or carminative mixture. Not much used nowadays, but earlier it was a most selling type of item as a cough mixture and carminative mixture. Pediatric drops is a pediatric liquid oral preparation. It's small dose given by calibrated dropper like this, and the abdac drop. These are abdac is nothing but a vitamins abbreviation drop, and a crocin drugs, mainly useful for the neonatal population. Syrup is a liquid oral preparation made in a concentrated sugar solution like syrup crocin for antimicrobial syrup, and these are all for the pediatric population. Semi-solid liquid for internal aqueous solution like aqueous solution containing one or more drugs, and a parenteral solution which is to be given by IV mainly. The sterile liquid or suspension packed in a sterile container. Single dose can be given by intramuscular, intravenous. Multiple doses, it is called it as a vial. This is an ampule single cut, mainly a glass one, and this is a vial containing a multiple doses, and a infusion like sodium lactate, sodium chloride solution, and it can be delivered in liters type, and also the blood transfusion by this route. For oral also, that is the oral polio vaccines. Next is the tincture like tincture lemon or tincture peppermint, and which can be used in a different pharmaceutical preparations. External use like skin application, usually emulsion or suspension like cosmetic purposes for the creams like betanoate cream, soframycin cream and all. Ear, eye, nasal drop, this to be instilled in ear, eye and nose. The eye drops must be a sterile, like example is a betanazole or nasobium nasal drop. Enema, these are the solution or suspension or emulsion for the rectal administration, and these are mainly made up of soap or glycerin base. In a severe constipating patient or in a hospital, the enema is to be given. Gargle used for the throat infection. Example is a betadine gargle, Listerine or hydrogen peroxide. Irrigation solution, this is to be placed in a body cavity, mainly bladder, with the help of catheter for producing a local action. Jellies, it can be a transparent or translucent non-greasy gels like lignocaine jelly, mainly useful to produce a local anesthetic action while performing small daycare surgery and all that, and for introducing a urethral catheter. Liniment, this is a liquid or semi-solid counter irritant, massage or rubbed on an affected part like turpentine liniment. Lotion, applied to the skin without friction, that is a calamine lotion. The basic difference between liniment and lotion is liniment to be applied with massage or rubbed, and lotion to be applied without friction. Mouthwashes like liquid preparation used for oral hygiene like Listerine mouthwash and all. Ointment, they are the semi-solid greasy preparation for local application to skin, rectum and mucous membrane like betadine ointment and betanoate ointment. Next one is the paints. These are the liquid preparation containing volatile solvent which quickly evaporate to leave a dry and resinous film of medicament on skin, and mainly useful for the sport person to relieve pain like rally spray or move and all that. Throat paint is a more viscous in nature due to high proportion of glycerin adhere to the affected area and prolong the action. Means it contains mainly glycerin components so as to keep the drugs for longer period of time, and the most commonly used is a Mendel's throat paint. PACE is the semi-solid preparation for external application containing a high proportion of finally powder medicament for greater protection and more absorption, like zinc oxide paste is available. Qualities like preparation for external use to reduce inflammation due to heat retaining capacity, but not much used clinically nowadays. Maybe in some remote area they are using, but not in a institution like AIIMS it is used. Inhalation dosage form, like I told you, aerosol. This is suspension of fine solid or liquid particle in a media like air or oxygen and administered with the help of a nebulizer. The most common use is for the treatment of asthma and all that, the ethylene inhaler. Spray, the preparation in oil and water administered by atomizer or nebulizer, used externally as a perfume in this one, and it can be used to relieve a local pain by athletes like Rally Spray, Move, Volitra, Voleni and all that. Vitrella is a thin-walled glass capsule containing volatile substances like amyl or octyl nitrate, and protected by a absorbent cotton wool and outer silk pack, and capsule is crushed and the vapors are inhaled, but it has been replaced by the automatic inhaler and a metered dose inhaler for giving all these to. So these are thank you very much. These are all the dosage forms which are used in a pharmacology, and various sources of drugs. We will show you the different dosage form. The class is scheduled on 8th of September 2020 in a new drug delivery system. On next class I will take how these drugs are to be administered in the body, the different route of administration, tomorrow at 2 p.m. and the scheduled class for 21st of August, Friday 8 to 9 will be held, will not be held actually, theory class. It will be covered in a practical classes while we show all the PPTs of other drug delivery system on 8